Welcome to another episode of Your Life Simplified. I'm Scott Sturgeon, once again with hosting duties for this episode. And today we're going to focus in again on the coronavirus, but I think from a little bit different perspective in what our previous episode covered. Today is much more from kind of the public health perspective and really specifics on the virus itself, kind of what the public should know, what you specifically should know, and kind of best practices as it pertains to ideally preventing the virus or dealing with it, as it continues to spread throughout our society. So our guest today is Dr. Chris Jenson. Chris has experiences 13 years as a physician in an emergency room setting. He also served as a science ambassador fellow for the Center for Disease Control and Prevention, i.e. the CDC. He currently works in education now. Chris, thank you so much for taking the time to sit down and kind of talk through this a little bit.
Absolutely. Thank you for having me. This obviously is an important topic for pretty much all of America.
It really is. It has completely dominated the headlines for the last really 2 weeks now. And I have kind of a hunch that it's really going to continue to do so, at least kind of from what we can tell. This thing is not going away. So I guess I'll add two caveats before we start. Number one, the information on this is constantly changing. So even what we're saying today could be completely changed within a few weeks. Number two, there's a lot of information out there, some of it very clear, some of it not so clear from lots of different sources. So with that small caveat in mind, Chris, the virus itself, could you kind of give us a breakdown on where it really comes from and how it really works?
Sure. So coronavirus in general has been around for a long, long time, and it's one of the familiar viruses that typically cause common cold symptoms. What's different about COVID-19 is that the virus had a crossover event that caused it to change, and the virus's ability to access certain parts of the body is now more adept. And so we're seeing this virus making infiltration into the human lung and doing things that it hasn't done before. And so when you go all the way back to the end of 2019 and look at what was going on in China, and obviously the epicenter was Wuhan, and there's some animal involvement and obviously some population density that plays into that. And then the outbreak really occurred. But basically what you're seeing is a beta coronavirus is typically found in animals, and that's what we're dealing with. And this virus has the ability now to cause problems, not just in non-human animals, but now in humans itself.
Right.
And so that's what makes it novel or new, is because we're seeing chunks of a virus that most human immune systems haven't dealt with before in some regard.
So hence the kind of the spread, really. It's almost like, I think what I'd seen quoted from a physician, some news article, was that coronavirus seems now almost like what a flu pandemic would look like if there were no vaccine for the flu. Is that accurate? Kind of fair to say?
There's some overlap that applies to that. I think the thing that they're honing in on with that aspect of the conversation is there are parts of this virus that are novel and new and giving immune system fits. And so you really need to have a healthy immune system to combat the virus. And the good news right off the bat is, most people do. Most people have a highly effective immune system that can deal with these challenges. And although we are expecting to see a good number of cases in the United States based on evidence in other countries, keep in mind that we've been seeing a play-by-play of the worst of coronavirus. Social media, regular media, and to no fault of their own, they're just trying to report what's going on. But we're kind of seeing the worst aspects in the news.
Right.
And if we broadcast influenza A or B every year, it would look scary like this. Now, what's odd about coronavirus, and I'm sure we'll get into this in a little bit, is that it tends to target specific groups. And it's a little different from the flu in that regard. The groups that it's causing some serious mayhem with.
Yeah. So one of the things I think that maybe you'd mentioned was kind of differentiating this virus from others was a lot of it has to do with the transmission of it, number one. And then as I guess a part of that kind of transmission process, a lot of it's asymptomatic. So I think, somewhere I'd read that's essentially 5 days you could have it within your system, be transmitting it to other individuals around you, but have no idea that you have the virus.
Right. So it's tricky. This COVID-19 virus has a wide array of symptoms. And for folks that are generally young with effective immune systems, the symptoms can be rather minimal, as simple as a cold. By a cold, I would define that as nasal congestion, stuffiness, runny nose, typical things we'd all describe as a cold. And there are some folks, as you alluded to, that are virtually asymptomatic, meaning that they were unaware they had it. And then, of course, the severe cases tend to seek out medical attention. And your point is excellent. That's what makes it so hard. Is it's very plausible that a lot of folks are going to get the coronavirus, be completely unaware, It will be no worse than any other typical cold they've
Mm-hmm.
endured. And they unfortunately might transmit it to other folks. The virus, to your earlier question, is spread by respiratory droplets. So you're thinking of sneezing and cough. And, most of our common cold and flu viruses are spread that way. So
Sure.
that's nothing atypical. But we really had a very interesting situation to study how the virus works. And that was the unlucky situation with the Diamond Princess cruise ship. And there's lots of data that we've looked at with China, South Korea, Japan, but the cruise ship in a very odd way, obviously you feel for the folks that got sick and the situation they were in, but in a very odd way, it was a isolated situation to watch the virus do its thing. And of the roughly 3,700 people on that cruise ship, approximately 700 ended up testing positive. And when you break that down, some of them were asymptomatic, most were mild to moderate cases, and only a few were severe. And when we studied the transmission rate of the virus on that cruise ship, when people are isolated to that proximity, it ended up having what's called an R naught, or the infectious rate of spread, of about 2.28. And that means that if I had it and I was on that cruise ship, I'm likely to give it to slightly more than 2 people before I'm really aware of what's going on.
Right.
And so that, interestingly enough, that R naught of 2, or my likelihood of giving it to 2 other folks, is pretty comparable to garden variety influenza. However, there are some aspects of the virus that seem to, as we learn more about it, seem to be particularly durable. It lasts a little longer than expected on hard surfaces and things like that. And so, if I sneezed on this desk and unfortunately had the virus, it might be around for more than a day. But those things vary depending on temperature and conditions. So they're really not reliable. But in terms of its ability to spread, it looks like it's comparable to influenza with an R naught right around 2.
Right. Well, that's an interesting point you bring up. I think some of the information we'd seen in the last few days, as looking back to previous kind of epidemics, differentiating that from a pandemic, I think that's kind of what the World Health Organization come out with that coronavirus is. But really, society today, even looking back to versus 2003, especially in China, I think we see that we just live in a very interconnected world. And so when you talk about, accidentally sneezing on your hand or something and touching something, that the virus can then live on that surface for conceivably days.
I think some of the rumors, although I don't know if they're really validated, are anywhere from 24 to 48 hours. Typically, viruses don't last that long, and that would also be other environmental conditions. But to your point, yeah, if it's out there, it's possible to contract. But I don't want to steer people in the wrong direction. Its transmission seems to be similar to a lot of respiratory viruses. So although we are seeing some unique problems with COVID-19, it's not really deviating that much from a typical respiratory virus in terms of transmission.
So then I think a good question then comes up, is there anything I should be doing? During cold and flu season, we say, wash your hands, cover your coughs. I think my nephews, that's a big thing, covering your cough, a little wing cough, I guess, like they hold their arm over their mouth. But are those the kinds of things that people should be mindful of? Or do I need to go to the drugstore right now and buy a mask and bunker down in my basement? Is that?
Yeah, I think the latter is a little bit of an overreaction. But I'm glad you brought up the question. So it doesn't seem particularly exciting to do these necessary precautions, but they do go a long way. So hand washing is an absolutely highly recommended event. And in fact, the CDC devotes an entire webpage to it. So who knew hand washing could be so exciting? But all sarcasm aside, whether it's soap on your hands for 20 seconds or hand sanitizer, both are going to be effective. You don't have to have Purell. And you can do that process. Sneezing and coughing into your elbow. But the bigger things are probably this: crowd deterrence, staying away from large groups is an exercise responsibility to do in terms of limiting the spread. And another thing to consider is that if you are sick, really social responsibility comes into play. Keep in mind, between now and summer, it's highly likely that the listeners in this podcast will get a cold. And you know what? Probably won't be corona. But this is a time to be vigilant, where you don't know what you have. If you're able to take care and medicate it at home, that's great. Keep yourself isolated from work. Certainly, we all want people to be as productive as possible, but this is the time where don't go back to work. And if you have a fever, don't go back to work if you're hacking all over the place regularly, because we'll get into this, I imagine, but the young tend to do extremely well. There are very few severe cases of coronavirus in folks under 60. And that's most of our workforce. And so what we really need to think about is how can we limit the overall spread of the virus? Because all of us undoubtedly have people in our lives that are elderly or fall into a high risk category, and we don't want to make them susceptible to it. And if you put a virus in a lot of people, well, then you're playing a numbers game. There's more likelihood that you'll spread it to someone who really is at risk.
Right, right.
Thanks again for downloading this episode of Your Life Simplified, which is produced by Mariner Wealth Advisors. And at Mariner Wealth Advisors, we're here to serve as your advocate. We help people chart a course to reach their personal and financial goals so that they can have greater peace of mind that may lead to a more fulfilling life. We do this by always putting our clients first. Because as fiduciaries, we're required to provide guidance that's in the best interest of clients, not in the best interest of a company or shareholders or anyone else. So as you listen to this podcast and have questions about maybe your own financial situation, or would simply like a second opinion, or even you have an idea for a future podcast, please go ahead and email us at podcast@marinerwealthadvisors.com. If you found the information on this podcast valuable, please go ahead and share it with a friend or family member that you think might benefit from this information. And please don't forget to subscribe to this podcast so you don't miss an episode. Thanks for listening, and now back to the episode.
So I guess just kind of playing devil's advocate, or fast forwarding, it's like you said, there maybe is some eventuality to the spread of this that, if you haven't had it yet, it's very potentially possible that within the next year or what have you, you might contract it. So I think we've heard a lot that 14-day time frame is kind of the appropriate amount to kind of quarantine yourself or isolate yourself. I mean, is there credence to that, or is there kind of a line in the sand as the best practice?
Yeah, great question. So on the CDC website, if you look at it, there is kind of a, for lack of a better description, incubation period or time period between 2 to 14 days, where if I made contact with someone and they transmit it to me effectively, and so I've taken in the virus, I may not present symptoms anywhere from 2 to 14 days. Mm-hmm. And so the thought is that if you have someone around you that was a known case, or, we don't want to go overboard with this. If someone has a cold at the office, but they come back a couple of days later and seem fine, chances are they're fine. We can't look at every possibility, but if you have a known exposure and you're around someone that is a proven entity to be a coronavirus, making sure in the next 14 days that you don't pop up with cold and flu symptoms is a very reasonable precaution. And how they pick that is they look at how the virus works, and it takes its genetic material and it puts it inside cells. And sometimes it doesn't go from the inactive phase, where it's just sitting with this genetic info inside your cells, to the active phase when it's making actual viral copies. It may not do that for 2 to 14 days. I believe the average onset is still around 5 days, but the CDC is trying to be thorough with their recommendations. And I think the WHO confirms that 14 days would be the most thorough event.
That makes sense.
Yeah. And again, I think the spirit of that recommendation is supposed to be for folks that have known travel exposure or known contact exposure, and being judicious about that. And if you're unsure whether you should engage in that type of quarantine, because it is disruptive to work, I get that. Making a phone call to your primary care physician, explain the situation, is an excellent way to sort that out. If you're not a nurse or a doctor or a pharmacist, that's what we're here for, is to try and help.
That makes a lot of sense. So I guess in that same vein is what's the best place to go for information on the disease? Kind of whatever the most current, up to date.
Sure. Well, as you mentioned, there are tons of things out there. Tons.
There are. Yeah.
And there's 3 things that I'm going to try and recommend that folks consider. The first one is the Centers for Disease Control has a special webpage with many, many tabs with specific information. And how you find it, the best way is just simply Google CDC and coronavirus. And that'll lead you right to it. And it has a situation summary that they update very regularly with statistics, information. It involves cases in the US, testing in the US, global map in terms of the pandemic spread. And for folks that are interested, what is the current plan out of the CDC and what initiatives are they taking? And so that's a great way to just make yourself knowledgeable. It's written at a level, it's very sciencey, but it's written at a level that, most deal well with and understand. And so I highly recommend that. There's also additional tabs about what you should know in general for your own personal health, travel information, how to prevent the spread of COVID-19 in your community, specific patient populations that are at risk and what you can do. The amount of information they've dedicated to this is really well done and excellent. And I'm not just saying that as a physician, just like my family found it useful. I referred my parents to it.
Yeah.
It was just a really very thoughtful and helpful read. A second thing that I would tell you is that the World Health Organization also has a lot of data, and very similar Google search, WHO for World Health Organization and COVID-19. We'll refer you to that. Now, that's going to be more things in terms of the general spread and looking at data from other countries and more the pandemic aspect. Some people might find that interesting, but if you want, again, like I mentioned, personal, insightful ways that you can be doing to prepare yourself and to prevent things, the CDC webpage may be more helpful. For those that have a strong interest in science and want to take it a step further and you want to read about it and just get some more information, I will tell you from February 24th, which admittedly is now starting to become a little outdated, but there was an excellent paper in Journal American Medical Association, JAMA Network, and it's entitled Characteristics of Important Lessons from the Coronavirus Disease 2019. If you Google JAMA COVID-19 summary, it looks at 72,000 cases in China and starts to identify, okay, so most people are not succumbing to a severe form of the disease. That's excellent. And it's got the data to prove that. And then secondly, it looks at the severe cases and subtypes them as to who's at risk.
That's great. Those are excellent resources. And again, I think it's great to hear, to have a very clear, succinct place you can go as opposed to just Googling coronavirus and you're going to be inundated with everyone's an expert now, I guess, in immune systems and what have you. So
absolutely. I mean, the just generic Google searches, that'd be like me Googling stock advice. And I don't have the financial wherewithal that you do. But I mean, you want to be specific about who you trust. And no organization is perfect, but the CDC information seems to be reliable. It coincides with the World Health Organization. The JAMA paper seems to reinforce it. All three of these things are, verifying each other's data and are well done. And they're all three different sources with the same information.
Chris, there's one question I think maybe would be decent to end on. And this one's tough. We at the beginning again said this is constantly changing. All the numbers are changing. The countries affected are changing, or even our knowledge of the virus is changing. From your perspective, though, if you look out over the next 6 months, 18 months, what have you, what do you see occurring, as it pertains to whether it's spread or, public health and the ability to deal with the virus, that sort of thing? I know, with your kind of knowledge and understanding of what's occurred thus far and in relation to previous pandemics, do you have a kind of a vision or an idea of where we're headed?
Yeah, that is the $1 million question that I'm probably not qualified to answer, but I'm going to give you some insight that I think is reasonable and trustworthy. I think if you look at the progression of the disease through China, the initial country, I think to say that this is at least an 8-week process is conservative, and how long it'll stray after that, I'm not sure. But we are seeing case numbers, new incidence cases of in China start to decrease, and that's promising. And so the time frame, I think, is obviously well over 2 months, and how far it'll extend, we're not quite sure. It depends how well we can isolate and limit the virus and the social responsibility that people engage in.
Sure.
So that's going to obviously be huge. I think that it's realistic to assume, much like influenza, that a lot of people will get the virus. The good news is that statistically, very few people will have severe cases. So once again, it goes back to that point we discussed earlier that you may get COVID-19, and that is obviously unfortunate, but if you are under 60 and you don't have significant cardiovascular disease, and you don't have severe chronic lung disease, and you don't have out of control diabetes, chances are you're going to do well. So now it just comes down to, how do I protect folks in those groups? And isolating yourself if you are sick until you're better, and staying away from large crowds, and hand washing are probably 3 reasonable things we can all do and remember. And so I think that's going to play into a lot. It also comes down to how effective we test in the near future. There were some hiccups with that testing process. Things seem to be in a better state now. But every medical community's ability to identify those who are sick does 2 effective things. 1, it gets them the appropriate help they need. And 2, it removes them from the population and unknowingly infecting others. And so I think we do need to test aggressively. If you look at the South Korean model, they have tested a lot of folks, and they may arguably have over-tested. And you look at their CFR, or case fatality ratio, and that number will change, over time.
Sure.
But right now it's right around 0.7%.
Right.
Well, why that is because when you calculate that ratio, it's simple math. Your numerator is your deaths. Your denominator is the number of people with the disease. And so they're testing and catching a lot of the asymptomatic folks. But the benefit of that is they're isolating those asymptomatic folks who otherwise would feel fine and go about their day.
Right.
And so I think a lot of healthcare workers would prefer that we over aggressively test and identify folks, because if I had COVID-19 and I'm doing fine, well, that's wonderful. But I also genuinely don't want to give this to someone else. And so even if it's in a tedious self-quarantine, just to know that I kept that away from high risk groups would make me feel better. And I think generally most people are that way.
Yeah. Not to ever make light of the situation. Obviously, there's been a lot of lives lost, and it is a tragedy to a certain extent. But I think you're exactly right that I think an important point to take out of it is make sure you're informed on what's correctly, up to date and really going on, but also kind of that social responsibility element of, maybe it is an inconvenience for you if you were diagnosed with it and got better, but making sure that you're taking precautions for whoever down the line. It could be a family member, it could be a stranger. You don't really know at the end of the day, but taking those steps in the long run is a relatively small burden, I guess, to put off.
I totally agree, and I think that's one of the home run messages that we hopefully get across to our listeners today. Is that just simple point. And, when you go to the CDC, you are welcome to read who's at higher risk, and it's going to identify the elderly, those with significant cardiovascular disease, significant chronic lung disease, high blood pressure, and diabetes are the main ones. And that corresponds with the Chinese data as well.
Right.
And so keep in mind that most Americans, first of all, are not in those risk factors and tend to do extremely well. And when you look at the potential case fatality rate of, let's say, the average 30 or 40-year-old booming through the workforce right now that doesn't have those comorbidities, it's somewhere around 0.2%.
Mm-hmm.
And so I certainly take this virus seriously, and I worry about the folks that are in the higher risk groups. And I just want, the general population, who most of us will do absolutely fine, to do what we can to help those folks that are actually at risk.
I think that's the perfect perspective to have. I guess one of the elements we didn't touch on, just to quickly address it, is that children aren't as impacted by the disease.
Correct. And that's one weird variation from influenza. If you look at just this year's season, influenza hospitalized more kids than we have in a long time. And typically respiratory viruses wreak havoc on the young. And we're seeing the young do great. Their immune systems are usually prolific. They mobilize a response in a quick fashion. To the best of my knowledge, as of March 10th, there were still no fatalities under 9 years old. And we obviously hope that this illness is minimized in that age group.
Yeah, absolutely.
That is the weird thing about coronavirus is it seems to be targeting specific groups. And so I think for most of us, we kind of just need to take a deep breath and think about the social responsibility we can exercise to really help those folks that are at risk.
Some true words of wisdom. Chris, thank you so much for taking the time to kind of talk through all this. It's been really enlightening.
Well, I appreciate the opportunity, and thanks for having me.
For those of you listening, again, we can't stress enough all these resources that are available. And I'll just reiterate, the CDC is an excellent resource. Just by Googling CDC coronavirus, you can find that information. And also the World Health Organization, WHO, coronavirus, just Googling that should provide, a lot of these resources that Chris talked about. So as always, thank you for tuning in. If you have thoughts or suggestions for new episodes for us, by all means, reach out. We really encourage your interaction. You can reach us at podcast@marinerwealthadvisors.com. Thanks for listening.
Wealth Advisors, or MWA, is an SEC registered investment advisor with its principal place of business in the state of Kansas. Registration of an investment advisor does not imply a certain level of skill or training. MWA is in compliance with the current notice filing requirements imposed upon registered investment advisors by those states in which MWA maintains clients. MWA may only transact business in those states in which it is notice filed or qualifies for an exemption or exclusion from notice filing requirements. Any subsequent direct communication by MWA with a prospective client shall be conducted by a representative that is either registered or qualifies for an exemption or exclusion from registration in the state where the prospective client resides. For additional information about MWA, including fees and services, please contact MWA or refer to the Investment Advisor Public Disclosure website at www.advisorinfo.sec.gov. Please read the disclosure statement carefully before you invest or send money.